In this film, we'll look at how to use a HeartSine AED in a cardiac emergency. We're using a HeartSine 350 training AED, but the live AED units work in the same way. There are other types of HeartSine AED. The 360 is a fully automatic AED, and the 500 also has CPR help and voice prompts to give you live feedback on your CPR. In this film, we're simulating CPR and AED use, as you never deliver CPR or put a live AED unit on a person unless there's a cardiac emergency. When you arrive at the scene and find a person unresponsive on the floor, we first need to establish what the problem is and follow these initial steps before using an AED. Firstly, we need to approach and check the scene for anything that could harm us. Stop, think and act. If available, put your gloves on. But as there's not a high risk of infection and time is critical, we don't waste time looking for them. Once you're sure it's safe, the next stage is to assess the patient as you learned in CPR training. Try and get a response by speaking loudly and gently shaking their shoulders. Open the airway, check for obstructions and do a breathing check for 10 seconds. If they're not breathing or breathing abnormally, begin CPR immediately. At this point, someone should call the emergency services. So if someone is there to help, send them to activate the emergency services and fetch the AED unit as quickly as possible. If you're alone, then you need to call EMS, which you can do with your phone on speakerphone while delivering chest compressions. Continue CPR until the AED arrives. Once the AED arrives, you'll need to get it onto the victim as soon as possible. If someone is there, ask them to continue CPR while you get the AED ready. This will help ensure that oxygen-rich blood is circulated to the body. Once the AED arrives, turn it on by pressing the power button to activate the voice prompts. Remove or cut clothing on the chest to ensure the pads directly connect with bare skin. This includes removing any bras or other items that may interfere with the pad placement or the shock process. Quickly inspect the chest area for pacemakers or surgical scars to identify if a pacemaker is present and avoid placing the pads directly over it. Pacemakers are usually fitted away from where the pads go. Remove any noticeable medical patches, as some contain metal which can interfere with the passage of electric shock from the AED. If you have an AED prep kit, use a razor to remove excess hair, but do not worry if you have nothing to remove it. Remove necklaces away from the chest area to prevent electrical conduction issues. Select adult or child configuration by adjusting the settings. One pad goes just below the collarbone on the victim's right side of their chest. The other pad goes under their left armpit on the side of the chest. For infants and children, the pads go on the front and back as shown on the diagram on the pads. Press the pads firmly onto the skin to ensure full contact and allow for effective electrical conduction. You must follow the voice prompts when it says do not touch the patient to avoid anyone else getting a shock or the AED detecting another heartbeat. Ensure no one is touching the victim. Loudly state something like, "Everyone stand clear." The unit will tell you it's assessing the heart rhythm, do not touch the patient. If a shock is needed, it will tell you to stand clear of the patient and that a shock is advised, or in the case of a fully automatic AED, that it's about to deliver the shock. A fully automatic AED does not require you to push a shock button, but if you have a semi-automatic AED, you will need to push the shock button. We'll now describe the semi-automatic version. Look around to ensure everyone is clear before pressing the shock button. Press the shock button when prompted. If the unit says no shock advised, continue CPR and follow the voice prompts. After the shock is delivered, the AED will instruct you to begin CPR. The AED unit has a metronome to guide you at 100 to 120 compressions per minute. If you're comfortable doing so, deliver 30 compressions followed by 2 breaths and repeat this until the AED tells you to stand clear. If you're uncomfortable providing breaths, just give the chest compressions until the unit tells you to stand clear. The AED will reanalyze every 2 minutes and advise when another shock is needed. If no shock is advised, continue CPR. Keep following the AED prompts until professional medical help arrives or the patient shows signs of life. If working alone, continue until you are physically unable to do so. Using an AED quickly can increase the victim's chance of survival, and it's essential to apply the AED as soon as possible. Using an AED may sound frightening, but they are easy to use and you could save the person's life. Stay calm, follow the voice prompts and trust the AED to guide you until medical professionals arrive. Finally, this film is about this brand of AED, but all AED units work in a similar way. So if you're not familiar with the brand, turn it on and follow the voice prompts.